Hello, sir. Am I audible?
Yes, sir, you are audible.
Okay. Thank you, Dr. Ajay Singh, sir, for your nice introduction. First and foremost, I would like to express my sincere gratitude to Professor Dr. Sailesh Sharma, sir, Director at Amar Said Baba Ajit Singh Jujar Singh Memorial College of Pharmacy, Bela, and Autonomous College. Dr. Ajay Singh Kushwa, sir, Professor and HOD, Department of Pharmacology, coordinator of this 6-day online training program on human anatomy and physiology too. I would also like to extend my thanks to Dr. Rahul Kumar Sharma sir, all faculty members of Bela College of Pharmacy for providing me with this opportunity to deliver my lecture in this FDP program. So the aim of this online training program is to provide the guidance on effective teaching methods and simplify the learning process of human anatomy and physiology to the students. So I'm going to share the slide. Sir, is it visible?
Yes, sir, it is visible. ठीक है सर
Okay, thank you, sir. So before starting the respiratory system and urinary system, I will provide the some tips for the faculty member, those who are joining in this FDP program, how we can engage this anatomy lecture for the students. So I will provide the some tips. I hope these tips will help to the faculty members regarding the deliver of human anatomy and physiology subject to the students. So whenever we'll start the lecture of human anatomy, the first is metaphors and relatable ideas. So first we have to give the some idea to the students कि our body we should compare with the machine. For example, if this is the cell phone, mobile phone, so we can compare our body with this mobile phone. Mobile has the various parts like display, though that display we can consider as a our skin, because in our skin also consists of various part like dermis, epidermis, hypodermis. So we can compare this our body with the machine so that students can feel free to learn about the human anatomy and physiology subject. Second is the create the interest of this anatomy subject to the students, or we can give the some informations about the importance of subject, inform the students about the importance of human anatomy and physiology subject, because this is a very fundamental subject for understanding the further study, like for the pathology or for the medicine or for the pharmacology. So we have to engage and create the interest to the students about the human anatomy and physiology subject. Third, we can provide the some fun fact and surprises, like how many cells are present in the body and what we call the cells of brain, like neurons or nephrons, so that students have this some curiosity about the subject. The most important point to attract or to attraction of this subject is visual. That is the we always focus on the 3D image, human body diagram, so that students can engage or understanding the complex structure of human anatomy. uh, we always advise our students to draw the diagram on the anatomical structure, review the this structure, because that visual help to transfer the information information from the short-term memory to long-term memory. So they never forget about that things. So always we have to done some long-term how they show their body anatomy. It not only show their body anatomy, but we can the answer the students. Next, as a this generation's mobile phone, cell phone, so they can download various mobile applications that are directly related to the human anatomy and physiology subject. We can also provide some multiple choice questions to the students to test their knowledge, identify the weak areas, and prepare for their exam. Next is the selection of test book. Selection of test book is very important for the study of the human anatomy and physiology. So number of books that are available in the market, but among them I will give some suggestion to the faculty members like BD Chaurasia, Bishram Singh. These books are very common and these books have the number of diagram so that we can easily deliver lecture to the students. Next is the histological slides. Histological slides can easily understanding the cellular structure and tissue of the anatomy so that students can be familiar with this slide and they can identify the which type of cells or tissue are present in this particular slide. This is also very important. Next, this human anatomy and physiology subject is very important for the national examinations like GPAT. In every year in the GPAT, around 4 to 5 questions they ask about the basic anatomy and physiology of human organs and system like cardiovascular, respiratory, digestive, nervous system, urinary system, and also that they can ask the physiological functions like metabolism, homeostasis, hormonal regulations, and cell structure and function. Next is the mnemonics. We can also prepare the some mnemonics so that students can easily understand. Here I have mentioned the some mnemonics like Mr. Nice, Dr. Sam. So that means that mnemonic includes the various system of our body like muscular system, respiratory system, nervous system, circulatory system, digestive system, skeletal system, anatomy system, and metabolic system. So next mnemonic is Mr. Lungs breathe air swiftly. So that is the mnemonic for the respiratory system and its part like mouth, nose, larynx, bronchi, and alveoli. Next, that there is a one mnemonics that is Mr.'s lit crunch that include the uh, system of our body. So this is the syllabus I will cover in this particular lecture. The as per the this syllabus that is 10 hours, but I will try to cover this within the 2 hours. So this is the model number 3. First, I will discuss about the respiratory system, and second is the urinary system. Sir, slide visible hai?
Yes, sir.
Hello.
Visible, visible.
Okay, okay. So first, let's discuss about the respiratory system. Before starting this topic, we have to ask to our students about the how do you breathe. So what is the importance of breathing? So we can ask to the students so that they feel more curiosity about this subject. First is like this breathing is important for the life. Breathing is how we bring oxygen into our body and removal of carbon dioxide or waste product as a metabolism. This is the first importance of breathing. Second is oxygen. It is a very importance for these various cellular and metabolic process in our body. Oxygen directly help to synthesis and production of ATP, adenosine triphosphate, by cellular respiration process. This is also very important for the exchange of gases that maintains the balance between the oxygen and carbon dioxide in our body, and that is also important for pH balance and overall body function. So there are some facts about the respiratory system. First is the your lungs are the only one organ that can float on water because that contains the air sac, and that make this is very dense. This is the some fact. Second is the you can take about 20,000 breath a day, but you don't even think about it because it is controlled by the our brain. Third fun fact is our lungs contain the around 6,000 million tiny air sac that is known as alveoli, and which is responsible for the exchange of gases in our lungs. The average adult breath is about 6 liter of air per minute. So that is enough to fill the two large balls every minute. So this is the some fun fact. Next, cigarette smoke contains about the 7,000 chemicals. You can just imagine that consists of 7,000 chemicals. Among them, some are very dangerous for our lungs, and that can lead to some chronic disease like COPD, asthma, and lung cancer. In every minute, your body uses around 250 ml of oxygen. Next is the whenever we are like stress condition or in the anxious conditions, the breathing rate can be increased, and that lead to 40 to 50 breath per minute, and that is higher than 22 to 20 breath per minute. So next fun fact is breathing on the moon. In space, astronauts need to wear helmet of oxygen because there is no air for the breath. So there is a one fish, that is whale fish, that hold the breath under water for 90 minutes, as a longer than the human beings. And human beings that we can hold breath for only around 1 to 2 minutes. So now I will going to discuss about the respiratory system. Come to the introductions part. So respiration, it is a normal biological process for the exchange of carbon dioxide and oxygen in our body. So respiratory system consists of various parts from the nose, nasal cavities, larynx, trachea, bronchial, and lungs. So there is a one fun fact in the respiratory system. Our human nose can detect more than 1 trillion scent. At the same time, it helps to breathing and killing the clean, warm, and moist for our lungs. So this is the very surprising things. Our nose can detect the more than 1 trillion scent. So you can just think about this. Next is the functions of respiratory system. The main basic functions of respiratory system is exchange of carbon dioxide and oxygen, and it also filter the inspired air that consists of oxygen. In the respiratory system consists of some receptor for the detection of smell and for the maintenance of water and heat of the air. This respiratory system is also help to regulations of blood pH. It also deliver the oxygen to the cells. Next, functions of respiratory system. It protects our body or that maybe consist of some harmful substance or irritants. It remove the some waste gases that include the carbon dioxide from the body. Next is the respiratory rate according to the age. So children have the more respiratory rate as compared to the adult because they have the less lung capacity. So you can see in this diagram, in the figure, that age with respiration rate. So if the children age is around 1 year, the respiratory rate is 26 to 40 breath per minute. If the age is 1 to 6 year, the respiratory rate is 20 to 30 breath per minute. If the age of the children is 6 to 11 years, the respiratory rate is 18 to 24 breath per minute. If the age of the children is around 11 to 16 years, the respiratory rate is 16 to 24 breath per minute. In the adult, the respiratory rate is 12 to 20 breath per minute. So if the age of the patient or age of the person is more than 60 years, the respiratory rate is 20 breath per minute. That external system divided inferior to the nose that consist of the nasal cavity. Hello, am I audible?
Yes, sir. Audible. Audible, sir.
Yes. Some network issues there, sir. So I was disconnected. So this is the nose. Nose is a most important part of the respiratory system, and this is the only one part that can easily visible by uh, outer part. So it consists of the two part that is divided the various type of cells like epithelium cells, which is responsible for which is responsible for Hello, 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 hello. Am I audible?
Yes, sir, audible.
Okay, sir. Sir, slide is visible.
Yes, sir.
Okay, sir. Thank you, sir, for confirmation. So, nose, this is the only external visible part of respiratory system. It is also known as a external nares, and which is divided by the nasal septum into the two parts. So, just interior to the nose, that there is a nasal cavity. In the nasal cavity, cells which are responsible for trapping the foreign particles and dust. The upper part of nasal cavity that consists of the paranasal sinus, which is help to warm up the air. So you can say, see this. This is the structure of the nasal cavity. The nasal cavity and oral cavity that is separated by the heart plate, and the in the nasal cavity that consists of the epithelial cells, which is responsible for trapping of foreign particles and dust. It also consists of the olfactory receptor for the detection of smell. There is a one fun fact on the nasal cavity. Nasal cavity produces about 1 liter of mucus every day to help trap dust and germs. Third part of respiratory system is a pharynx. Pharynx, it is also known as a throat, and that is around 13 centimeter long. So the main functions of pharynx is passage of food as well as air, and it divided into the three part, that is nasopharynx, oropharynx, and laryngopharynx. The function of nasopharynx is transfer of the air from the nose or from the nasal cavity to the larynx. However, this oropharynx and laryngopharynx is also responsible for the passage of food and air. So there is a one fun fact why we can't breathe and swallow at the same time, because there is a pharynx that prevents the food from going down to your larynx part. So you can see in this diagram, this pharynx can be divided into the nasopharynx, oropharynx, and laryngopharynx. Next important part of respiratory system is larynx. It is also known as voice box, or it is also known as a Adam apple. This larynx connects the pharynx to the trachea. Trachea is also known as a windpipe, and that is play the important role in the breathing, sound production, and protecting the airway during the swallowing process. So in the larynx that consists of the some cartilage, the function of this cartilage is to support and protect the vocal cords. It also prevent the swallowing of the some materials to the lower respiratory tract. So this is the functions of larynx. So in our body, this larynx is act as a DJ booth for your voice. So that means it makes the vibration from your vocal cord, and it creates the some sound of your voice. That is the reason we can talking, we can singing. So This all credit goes to the pharynx. So in the diagram also you can see this pharynx have this some cartilage, and that is responsible for the support and protection of our vocal cord. Next, very important part of respiratory system is a trachea. Trachea, it is a commonly known as a windpipe, and this is the tube-like structure that connect the larynx, that is voice box, to the bronchioles or bronchi. So it also play the importance role in the respiratory system by passing the air to the lungs. So in the diagram also you can see this is the pipe life structure is known as a trachea, and the trachea, if you are talking about the length of this trachea, is around 12 centimeter long, and that present in the fifth thoracic vertebrata. So in the trachea that consists of the C-shaped hyaline cartilage ring, that the function of this cartilage, it provide the rigidity for the trachea so that that can remain open for all times, and we can take the oxygen, and it can exhale the carbon dioxide from the body. So there is the reason. Trachea, if you are seeing the cross-sectional anatomy of this trachea, you can see in this diagram from the anterior part and from the posterior part. In the posterior part you can see the esophagus range, but from the anterior views you can see there is a different type of ring, like hyaline cartilage ring and some submucosal layer, lumen of trachea. These all are responsible for passage of air. So the main functions of trachea, it is a primary function of trachea is to carry air from the larynx to the bronchi. Second, it protect because it consists of cilia and some other mucus that trap the dust, bacteria, foreign particles that preventing to enter into the lungs. So third main function of trachea is cough reflex. Trachea help to trigger the coughing when foreign particles or other irritant or any other environmental pollutions that are come inside the lungs. So it detect and produce the cough reflex signal. Next, important part of respiratory system is a bronchi. So after the completion of trachea, you can see there is a divided into the two part that is known as a bronchi, and that is left bronchi and right bronchi. So it particularly pass to the corresponding lungs. Left bronchi go to the left lungs, and right bronchi goes to the right lungs. So the right bronchi is, you can see this is the shorter and wider as compared to the left bronchi, and that bronchi have the some cartilage, and that cartilage and bronchi has the some functions like it help to transfer of the air. It also help to distribution of air in the lungs, and it protect the some foreign particles, dust to into the lungs. Next part of the respiratory system is a bronchioles. This is the small or division part of the bronchi, and these do not have the cartilage. So this is the main difference between the bronchi and bronchioles. Bronchi has a cartilage, but bronchioles does not have the cartilage. So in the diagram also you can see there is a larynx. Behind this there's a trachea, and this trachea is also go to the down part, that is the primary bronchi, and after primary bronchi that divided into the secondary, and secondary goes to the tertiary bronchi, and last one the part is a, that is a bronchioles, and that is very small, that is less than 1 mm in diameter. So what are the function of this bronchi? It help to distributions of air and regulation of airflow in the lungs. It also help to filtration and protections of the foreign particle, foreign dust. inside the lungs. Next part of respiratory system, that is air sac. It is also known as a alveoli, and it is a the alveoli you can see in this diagram, that is surrounded by the some pulmonary capillaries, and the diameter of this air sac is around 200 to 300 micrometers. That means it is very tiny and balloon like structure which is present at the end of bronchioles. The main functions of this air sac is exchange of oxygen, exchange of carbon dioxide between the lungs and bloodstream. So this is very important as a MCQ questions. If it sometimes they can ask in the some national exam also. See which part of respiratory system is responsible for exchange of gas, that is alveoli or air sac. So that contains of very thin layer of epithelial cells that surrounded by the capillaries, and in the alveoli that consist of more than 300 million of small air sac. You can just imagine how many air sac are present inside the lungs. So this is the uh, next important respiratory system of is that is lungs. Lungs is a very essential organ of respiration, which is responsible for exchange of carbon dioxide and oxygen. So the lungs is a, you can see in the diagram, this is the conical shape, and that upper part of lungs is known as a apex, and which is located in the chest, or we can say it in the thoracic cavity. The right lungs is slightly larger as compared to the left lungs, because left lungs having the smaller volume due to the some space of left lung is that is occupied by the heart. So we have two lungs, that is right and left lungs. If you are talking about the left lungs, that is divided into the two lobes, that is superior and inferior. And between the superior and inferior, there is a consist of cardiac nodes, that is the depressions part of the lungs, and which is responsible for the providing the space for the heart. So if you are talking about the right lung, it consists of the three lobes, that is superior, middle and inferior. This is very important, and sometimes students are confusing which lungs has a two lobes and which lungs has a three lobes. So you can remember this left have the two lobes and right lungs has the three lobes. So after the lungs, this another very important part of the respiratory system, that is a pleura and its cavities. So outside of the lungs, that is consist of double layer, that membrane that surround and protects the lungs is known as a pleura, and it consists of the some cavities. So pleura has a two layer, that is visceral pleura and parietal pleura, and that between these pleura, visceral and parietal pleura, that consist of the some liquid, and this liquid has the some functions. So what are the function of this pleura? First is it provide the protection of the lungs, because this pleura act as a protective barrier for the lungs. Second, functions of this pleura, it consists of the fluid that is present between the visceral and parietal pleura, and that are responsible for reduce the friction. And third, functions of pleura is facilitations or of the breathing. During the breathing time, our chest wall is expand and the diaphragm contract. So pleura assist in the smooth movement of lungs that allow the extend and contract of the thoracic cavity. So these are the functions of pleura, and this is very very important for the exam point of view also, because it consists of the two layer and that help to surrounding of the lungs. Next important point of the respiratory system, that is mechanism of breathing. mechanism of breathing. This is very important for the 5 and 10 marks in the human anatomy and physiology. So breathing that normally depends on the volume accents that occurring in the thoracic cavity. So that is depend on the two part. First is the inspiration and second is the expiration. So what is inspiration? Inspiration is a breathing in. That means when intrapulmonary volume increases, the gas within the lungs is spread out to fill the larger space. So whenever we'll take the breathing, that air continuously go to the lungs until the intrapulmonary pressure that should be equal to the atmospheric pressure. So that is known as a inspirations. Next is the expirations, that is breathing out. It is a very largely passive process that is depend on the natural elasticity of lungs. So exact what is the difference between the inspiration and expirations? We can see in the this table, inspirations and expirations. Inspiration, it is a active process, and expiration, that is passive process. In the inspiration, there is a contractions of external uh, intercostal muscles and relaxation of internal intercostal muscles that occurs in case of inspiration. But in case of expiration, there is a relaxation of external intercostal muscles that is present in between the ribs, and contraction of internal intercostal muscles. So this is the difference between the inspiration and expirations. Next, in case of inspirations, the rib cage move forward and outward. For example, if I will take the breathing, the rib that move forward and outward. Whenever we'll relax that expiration, the rib cage move downward and inward. Next is the diaphragm. In case of inspiration, the diaphragm is a contract and that become the flattened. But in case of expiration, the diaphragm is a very relaxed and that is go to the original dome shaped. In the inspiration, there is a increase the volume of thoracic cavity, but in case of expiration, there is a decrease in the volume of thoracic cavity. In inspiration, air pressure in the lungs is less than the atmosphere pressure. Therefore, we inspire. Whenever and next, in case of expirations, air pressure in the lungs is greater than the atmospheric pressure. So this is the main difference between the inspiration and expiration. This is known as a mechanism of breathing. So I hope you understand. And next is the external respiration and internal respiration. So this is important for 2 marks in your exam. Define external respiration and internal respiration. So exchange of respiratory gas between the oxygen and carbon dioxide in lungs and blood, that is known as external respirations. Whenever there is an exchange of gas, that is oxygen and carbon dioxide between the blood and tissue, that is known as a internal respiration. So this is very simple. So come to the volume and capacities of lung. First is the tidal volume, and this is very important for 2 marks in the sessional as well as for the final paper. So what is tidal volume? Tidal volume, it is defined as a volume of air that is inspired during the normal respiration. For example, we are taking the normal respirations. So this is tidal volume, and that can be measured with the help of this spirometry. So this is the spirometry. With the help of this, we can measure the tidal volume and vital capacity. So in this spirometry consists of the three bulb, that is red in color, blue in color, and yellow in color. Is it visible? Hello, sir. Is it visible?
Yes, sir. Visible, sir.
Okay, thank you, sir. So this is the spirometry. Spirometry consists of the three bulb, that is red, yellow, and blue color. So it consists, it have different capacities. If you are talking about the yellow bulb, this have the 600 capacity, and if you are talking about the this yellow bulb, that is around 900 capacity, and there is a blue color bulb. This have the 1200 capacity. So first is a tidal volume, that means volume of air that inspired during the normal respiration. For example, if I put in the mouth, so this is the normal respirations, the bulb will no go up and down because this I am not giving the forcefully. But there is a inspiratory reserve volume, that is known as a IRV. IRV is a forcefully over or above the tidal inspirations with the maximum effort. For example, if I will uh, forcefully inhale the gas, like, so this is the IRV. That means volume of air that inspired forcefully, that is known as the IRB, and that is variable in case of male as well as in the female. In male it has around 3300, or in case of female it is around 1900. So this IRB, tidal volume, ERB, that we all are calculated through the spirometry. This is IRB. Next is the expiratory reservoir volume, that we can also calculate with the help of spirometry. If in these conditions, the volume of air that is expired forcefully over or above the tidal inspired with the maximum effort. For example, so this is the expiratory reserve volume. You can see here the bulb is going up. So we can calculate with the help of spirometry about the ERB, IRB, and tidal volume. Next is the residual volume, that is defined as a volume of air that is remains in the lungs after the end of maximum expiration. For example, when I'll do the maximum expirations, the remaining volume that is present in the lungs is known as a residual volume or RB volume, and that is around 1200 ml. So that can be calculated with the help of helium dilution techniques and some other method also. Next is the functional residual volume capacity. It is a additions of ERB plus RB. So if you will add the ERB plus RB, then you can get the FRC. Next is the vital capacity. It is defined as the additional of IRB, tidal volume, and ERB, that is known as a vital capacity, and it is a volume of air that expired forcefully after the forcefully inspirations. So there is a one formula, BC is equal to IRB plus TB plus ERB, and that can be measured with the help of spirometry. Next is the total lung capacity, that is maximum air in the lungs after maximum inspiration, and that may be variable in the male and female. So normal TLC, that is total lung capacity, is 6000, and that can be measured with the help of helium dilution technique, nitrogen washout method. So this is the graph about the respiratory volume and its capacity. You can see this tidal volume. You can see between the 2000 to 3000, and there is a IRB, ERB, RB, vital capacity, total lung capacity. So this is very important for the final paper. So next, some respiratory system disorders. So various disease or disorder that are associated with the respiratory system, like influenza, lung cancer, tuberculosis, bronchitis, asthma, COPD, common cold. So I'll discuss one by one. First is the most common respiratory system disorder, that is asthma. Asthma, it is a chronic inflammatory disorder that is caused by increase in the air hyper responsiveness and that leads to various symptoms like coughing, wheezing, shortness of breathing, tachycardia, difficulty in the breathing, dyspnea, and chest tightness. So there are some etiology of asthma like allergy, inhalations, some air pollutions, exercise, or during the cold time or dry air, or person is taking the stress or some drugs that are also responsible to cause the asthma. So if for the treatment of asthma, doctor or the physician prescribe the some broad spectrum antibiotics, beta 2 agonist like salbutamol, torbutalin, or some respiratory support therapy, some nutritional fluid and electrolyte as a supportive therapy. Second, respiratory system disorders is a influenza. It is the flu-like symptoms, and that is caused by the RNA virus. And like influenza virus A, B, C, and D, they are responsible to cause the influenza. And these are the symptoms of influenza like coughing, fever, heavy headache, weakness, and throat infections. So how we can treat this influenza? By the vaccination. Otherwise we can give this some antiviral medications, proper hygienic, that is non-pharmacological treatment, and some nutritional and fluid support. Through that also we can treat this influenza. Next, important disease that is associated with the respiratory system is a pneumonia. Pneumonia is a inflammatory process in the lung parenchyma, and that is associated with marked increase in the fluid inside the lungs. So there are some agents, causative agents or bacteria that are responsible to cause the pneumonia, like Staphylococcus and influenza. They are normally responsible to cause the pneumonia. So there are some symptoms of pneumonia like chest pain, and then formation of edema in the lungs, or sputum, cough, headache, uh, body rising the body temperature. So how we can treat this pneumonia? We can use this some broad spectrum antibiotics, and some respiratory support therapy, and some we can also give this some fluid and electrolyte to manage the pneumonia in the patient. Next important disorder, that is bronchitis. It is a inflammation, or we can say swelling of the bronchial tube, that is responsible for passage of oxygen or air from the nose to the lungs. So bronchitis has the various uh, symptoms like prolonged cough with the mucus, the body temperature will rise, chills, fever, sore throat, infection, headache, some dyspnea, that is shortness of breathing, nose and sinus congestions. These are the symptoms of bronchitis. So these can be caused by the bacterial or viral infections, or sometimes smoking, or some suppression of our immunity system is also responsible to cause the bronchitis. This can be treated by the some mucolytic or expectorants agent, or bronchodilator like salbutamol, torbutalin. So we can also give the steroids or antibiotics to the patient for the treatment of bronchitis. Next, respiratory disorder that is tuberculosis. Tuberculosis affect the number of population in India and surrounding country, and this is the primary affecting the lungs. And tuberculosis can be divided into the two types, that is a primary or pulmonary tuberculosis, and the second is the extra pulmonary tuberculosis, and that is causes by the gram positive bacteria known as mycobacterium tuberculosis. So that consists of various symptoms like cough, weakness, dyspnea, loss of appetite, and there is a palpitation, tachycardia, weight loss of the patient, and excessive sweating during the night time. These are the symptoms of tuberculosis. So tuberculosis can be treated by the DOTS therapy, or that is a primary and secondary antibiotics, or some we can also use the some mucolytic or steroids for the treatment, and some antibiotics also. Next, COPD. COPD is a one of the obstructive pulmonary disease, and that is characterized by irreversible airflow limitation due to the formation of emphysema, and that is caused by the some smoking like cigarette, air pollution, or that may be caused by the some genetic abnormalities. So there are consist of various symptoms of COPD like chest pain, fatigue, weight loss, dyspnea, respiratory infections, or maybe coughing. So how we can treat this COPD? We can give this some bronchodilator agents like salbutamol, torbutalin, or we can also give this some corticosteroids. If the persons have the serious COPD condition, then we can do the surgical management also. Next is a lung cancer that is caused by the smoking or maybe air pollution. So there are some symptoms of the lung cancers like wheezing, shortness of breathing, weight loss, feeling tired. So these are the symptoms, and which are causes by the like smoking, heavy metals exposures like aluminum, cadmium. They are also responsible to cause the lung cancer. So how we can treat this lung cancer? By photodynamic therapy. Some we can also perform the laser therapy like some radiation. Through that also we can treat this lung cancer. Next is a lobectomy, that means removal of the lobe of lungs, or we can use the some corticosteroids or some chemotherapy agents for the treatment of lung cancer. So next slide is a recent research in the respiratory system. So various research that has been conducted preclinically and clinically to treat the various chronic obstructive pulmonary disease. First is the artificial lungs. So scientists have developing the 3D printed artificial lungs that is looking like the lungs, and to help the patient with lung failure, potentially resolving or organ transplantation. So this is the structure. You can see this is the structure of 3D lungs. So scientists are working on this techniques. Next is the breathing and brain function. Deep breathing that is also improve the brain function, which reduce the stress, emotional, and that can help for the pulmonary function also. So recent research has found that uh, the probiotics is benefit for the gut health, same as a probiotics for the lungs. Also we can use this some microorganism so that they can protect against the respiratory system. Some innovations are in the asthma treatment like new biological therapies that targeting immunity system, and scientists are also exploring the use of stem cells to repair and damage the lung tissue, and that can be potentially used for the treatment of asthma and COPD. So there is a one video I'll show you.
Hey there.
So sound, is it audible?
Yes, sir,
Hello.
audible.
Welcome to this session.
So I'll summarize about the respiratory system in this video. I hope you like
Let's
this.
begin this session by doing some deep breathing. So take a deep breath in, hold, and breathe out. Repeat again. Aren't you feeling fresh and energetic? But tell me, where does the air actually go when we breathe? You might say it goes to our lungs. Well, yes, it is correct. The air passes through the respiratory tract and then enters the lungs. So let's explore the features and the parts of the human respiratory system. The air enters the human body through nostrils, which then passes through the nasal cavity. The air is filtered by specialized hair-like structure in the nasal cavity called cilia. The cells of the nasal cavity secrete mucus, which helps to trap the dust particles and blocks it from moving ahead. The nasal cavity also provides warmth and adds moisture to the air. The nasal cavity has specialized sensory cells that are sensitive to smell and odor. And yes, that is the reason why the nasal cavity wide. You accidentally entered this is because this
हेलो जी सर। हेलो। अच्छा सो नहीं हो रहा है, ठीक है सर। ओके। ओके सर। अच्छा अच्छा ठीक है सर, मैं फिर स्टार्ट करता हूँ, है ना आपका। ओके सर। हेलो, एम आई ऑडिबल सर?
Yes, sir, audible.
ओके सर। So I hope yeah, you understand about the respiratory system. Now I'm going to discuss about the urinary system. So next topic of this today's FDP is urinary system. So urinary system, it is also very important, and there is a some fact about the urinary system. Our kidney filter around 50 gallons of blood, that is equal to around 180 liters of blood a day, and that produce around 1 to 2 liter of urine. This is imagine we can live with just one kidney. If one kidney work properly and function properly, then we can live by just one kidney also. Our bladder that can hold up to this 16 ounce, that is around 473 ml of urine, uh, comfortable, and that has the stretch receptor and stretch capacity to hold more also. Next, interesting fact is men have the longer urethra, that is around 8 inches, and women have the around 1.5 inches urethra. So therefore, that women are more prone to the urinary tract infection. So urine color normally we can see in the healthy they have the pale yellow, but sometimes that urine color may be variable depend on the like dark urine that indicates the persons may have the some dehydration or otherwise some health issues. So this is the some fun fact. So now I'm going to discuss about the uh, going to discuss about the urinary system. So this is the urinary system. You can see in this slide. Urinary system refers to the organ that consists of the uh, like kidney. You can see here also. This is the kidney. Uh, you can see this from this is the anterior views of the kidney, and this is the posterior uh, views of the kidney that consist of the ureter that is attached to the bladder, you can see, and that bladder that it's going down is a urethra. So this urethra has a different capacity of the male and female. You can see here, this is the 3D structure of the urinary system. So next is the urine. It is a liquid byproduct of metabolism in the human body, and that is consist of water, urea, and sometimes that consist of the creatinine and some various ions and metabolite products. So what are the functions of urinary system? The main basic function of urinary system is to remove the waste product or excess substance from our bloodstream or from the body. Second, it helps to maintenance of homeostasis by regulating the volume and composition of body fluids. Third, it maintains the electrolyte balance, blood pressure, and production of RBC cells. It also excretion of waste product and maintenance of fluid and electrolyte balance. It maintains the acid-base equilibrium balance for physiological activity. It regulates or it produces some hormones like renin and RAS that control the blood pressure by the hormonal mechanism, and it also help to synthesis of the some vitamins like vitamins D, and these are the functions of urinary system. So organs of the urinary system, there are two kidneys that secrete the urine. Second, just below the kidney there is a two ureters that transport the urine from the kidney to the urinary bladder. One urinary bladder that collect and store the urine, and next is the urethra that help to throw out the urine from, or we can say discharge of the urine from our system or body. Let's discuss one by one. First is the kidney. This is the anatomy of kidney is very important for the final as well as for the sessional paper for the students also. So kidney, you can say this is the bean-shaped organ, and that is around 11 centimeter long or 6 centimeter wide or 3 centimeter thick. And the weight of individual kidney is around 150 gram. The right kidney is usually slightly lower than the left kidney. You can see in this diagram also. So location of kidney, it is a posterior, lie on the posterior abdominal wall and just behind the peritoneum and below the diaphragm. So this is the location, basic structure of the kidney. So here you can see this kidney have the outer capsule part that help to surrounding the kidney. Just below this capsule, there is consist of the two part that is cortex and medulla. Cortex, you can see this is the reddish brown layer tissue that is just below the outer capsules and just outside the pyramids. So next part is the medulla. Medulla is a innermost layer that consists of pale conical shaped. You can see there is a some conical shaped part that is known as a medulla of kidney. Next, very important part of the kidney that is nephrons. A nephron, it is a very basic and smallest functional unit of kidney, that is known as nephron. Each kidney has around 1 million nephrons. So in the preclinical animals like rat or mice, they have only 12,500 nephrons. But in case of human being, we have 1 million nephrons that are present in the individual kidney. So this is the basic structure of nephrons that can be divided into the various part, which is started from the Bowman capsule or glomerulus, then PCT, and next is the loop of Henle, then descending loop of Henle, then ascending, then next is the connecting tubule. So in the diagram also you can see nephrons that consist of the tubular closed part, that is started from the Bowman capsule and glomerulus, and another end that is open, that is known as a collecting dove. So this nephron we can divide it into the three part, that is first is PCT,
Sir,
second is
your
a
slide, you're not visible.
sir, slide is not visible, sir.
Sir.
Hello.
Yes, sir, visible.
So shall I repeat again, sir?
Uh, just fine, sir. You
Hello.
can go ahead.
Okay, sir. So nephron has a three part, that is a PCT, loop of Henle, and DCT. Uh, okay, I'll discuss from the nephrons. Okay, sir. Nephrons is a very small part of uh, or smaller functional unit of the kidney, and each kidney has around 1 million nephrons. That is the number of collecting duct transport urine through the pyramid to the renal pelvis. So some preclinical animals like rat, mice, they have the very less nephrons, that is around 12,500 nephrons that are present in the their kidney. But humans have around 1 million nephrons in kidney. So that can be divided into the different part, like starting from the glomerulus, that is Bowman capsule, then PCT, then loop of Henle, go to the descending order, then ascending, then DCT, that is distal convoluted tube, and last part of the nephron is a CT, that is connecting tubules. So nephron have the one is a open and another side is a closed tubules. From the that closed tube consists of Bowman capsule, glomerulus, and in the open duct that has a collecting duct. So we can divide it into the three part, that is proximal convoluted tubules, that is PCT. Next is a medullary loop, that is loop of Henle, and third is a distal convoluted tubules, that is DCT. So what are the function of PCT? PCT help to reabsorption of most water, glucose, and essential ions like sodium and potassium. They are absorbed from the PCT. Next is a loop of Henle that concentrated urine by absorbing the water, salt, and it also help to maintenance of body water balance. The next function of DCT that regulate the ion balance like sodium, potassium, and it also regulate or maintenance of pH of urine. Last part of the nephron, that is a collecting duct that help to formations of urine, and it also regulate the water and electrolyte balance. Next part of the urinary system, that is ureter. Ureter, you can see this have the inner longitudinal layer and outer circulatory layer. You can see in this diagram also. So inner is a longitudinal layer and outer part is a circulatory layer. So what is the function of ureter? Ureter carries the urine from the kidney to the bladder. This is the main function of ureter. And the ureter is consist of the some tube that is around 10 to 12 inch long, and it consists of the some muscles that help to contractions and help to move urine towards the or downwards. So in the ureter, there is a consist of one valve that is known as a uretrovesical valve that prevent urine from backward into the kidney. This is the main functions of the uretrovesical valve that prevents urine from the backward into the kidney. Next part of the urinary system is a bladder. The functions of bladder, it is a store of urine until it is ready to be excreted. The capacity of bladder is around 500 to 700 ml. That is comfortable, but depend on the situations. It can be up to the 900 or 1 liter also, because it consists of the muscular sacs and muscular sac that can be expand or fill with the urine. So in the ureter, that consists of the some detrusor muscles that help to contract and push urine out during the urinations process. So this is the basic structure of the bladder, which consists of urine also. Next part of the urinary system, that is urethra. It consists of the internal urethral and external urethral sphincters. And this is the basic anatomy figure of the female urethra that consists of the distal muscles or sphincters or other part. So female have the different capacity of urethra and male has a different. In case of female urethra, it is a very short and that is around 1.5 inches long, and that connect the bladder to the external opening, and that help to passes of urine from the body. Next part of is a urethra in the male. Male has a longer urethra and they have the less chances of some urinary tract infections as compared to the female because of this reason. In the male, this urethra has a dual function. First, it helps to transport of the urine, and second importance function of urethra in the male is it carries the semen during the ejaculation process. The male urethra passes through the penis and it divided into the three part that is known as a periostatic urethra or spongy urethra and membranous urethra. So that help to transfer of the semen during the ejaculation process. Next, very important point, that is the physiology of urine formation. It is very important for the final paper for the human anatomy and physiology subject. Formation of urine, it is also known as a uropoiesis, and that normally occurs in the renal pyramid part because that consists of the renal cortex and renal medulla, and that is having the nephrons. So that is responsible for the urine formations. Glomerular filtrations rate, second is a tubular reabsorption, and third is tubular secretion. So first, let's discuss about the glomerular filtrations. Water and other small molecules that are easily passes, but some blood cells like RBC, WBC, and platelets and other molecules are not easily passes through these glomerular filtrations. So filtrate containing the large amount of water, some importance glucose, amino acid, uric acid, urea, and electrolytes. So volume of filter that is formed by the both kidney is known as a glomerular filtration rate, GFR. So this is important for the 2 marks. What is GFR? The GFR is a volume of filter that is formed by the both kidney in each minute is known as a GFR. So normal GFR of the adult persons is around 125 ml per minute, but that may be variable depend on the if the persons have the chronic kidney disease, acute kidney disease, the GFR rate can be decrease or decline. Next is the tubular reabsorption. It is a very highly selective part, and that include the some substance like glucose, amino acid, and that are completely reabsorbed from the tubular part of nephron. Reabsorption of substance is known as a passive method, and some substance that are also absorbed with the help of active transport or active diffusion process. However, water that can be reabsorbed by the osmosis process from the tubular part of the nephron. So this is the diagram. You can say this is there is a blood, and this is the nephron part of the nephrons, and which can be absorbed by the active and passive diffusions, and that water that is absorbed with the help of osmosis method. Next part of the urinary formation is a tubular secretion. The positive charge ions like sodium, potassium, they can absorb by the active transport method, but negative charge like bicarbonate, chloride, that can be reabsorbed from the tubular part with the help of passive transport method. So excessive potassium ions secreted by the tubules that exchange with the sodium ion, and that make the some maintenance of sodium and potassium in the body. If the sodium is not exchanged with the potassium ion, then that may causes the some clinical conditions known as a hyperkalemia or hypocalcemia condition or hyponephремia. So tubule secretion help to maintain the acid-base balance. It also regulates the various electrolytes like sodium, potassium, bicarbonate, and it also removes the some waste product like urea, creatinine from our blood stream. Next, important that is a micturations is a process by collecting or removing the urine from the urinary bladder, that is known as a micturation process. When our bladder fills about around 300 ml of urine, it creates some pressure, and that activate the sacral section of our spinal cord. So here you can see in the diagram, uh, the urinary bladder is a fill around 300 ml of urine, and that send this signal to the sacral section of spinal cord through the pelvic nerve. Because in the bladder that consists of a stress receptor that give this signal to the uh, pelvic nerve in the sacral section of spinal cord. With the help of afferent nerves, that the signal is goes to the pons part of the brain, and that pons is analyze the signal, and that provide the some efferent nerve actions, and then we go for the urination process. So this is the basic structure and mechanism of the micturations reflex. Next, role of kidney in acid base balance, that is bicarbonate reabsorption. Our kidney filter the bicarbonate from the blood, and reabsorption of this bicarbonate from the proximal convoluted tubule, that is PCT. But in the PCT, these bicarbonate ions, that is HCO3, bind or combine with the hydrogen ions, because this hydrogen ion is a free here, and this from the carbonic acid that is known as H2CO3. In the tubular part of this nephron that consists of the one enzyme that is known as a carbonic anhydrase. What this enzyme do? This convert the bicarbonate into the water and carbon dioxide. The carbon dioxide that diffuses into the cells, and this combine with the water, and that create the more bicarbonate ion in our body, and this newly formed bicarbonate ion then transfer back to the blood, and it helps to maintenance of body pH. So this is the basic functions of this bicarbonate ion. So in the diagram also you can see this bicarbonate ion that is filtered by the PCT and reabsorbed by the PCT, and that bind with the hydrogen ion and that formation of the carbonic acid. But there is a one enzyme that is known as a carbonic anhydrase that convert this bicarbonate into the water and carbon dioxide. This carbon dioxide diffuse to the cells and that combine with the water and that produce the more bicarbonate ion, and that is responsible for the maintenance of body pH. Next is the role of kidney in the acid base balance is a hydrogen ion secretion. Kidney also secrete the hydrogen ions into the urine and that remove the excess acidity from the body. In the PCT and in the DCT, the hydrogen is exchanged with the sodium ions, and during this exchange the sodium balance with and excessive hydrogens is removed from our body, and that helps to maintenance of pH of body. So here you can also see in the diagram this hydrogen that exchange with the sodium, and that help to removal of excessive hydrogen from free hydrogen from the body, and which help to maintenance of body pH. Next important uh, part is ammonia. Ammonia that is also importance for the acid base balance. The ammonia that is produced by the kidney because whenever we consuming the proteins or some glutamine that converted into the ammonia, and ammonia converted into the urea, and that is excreted from our body. Here what happened, ammonia is produced in the kidney from by breaking of the glutamate and other amino acid. This ammonia is bind with the hydrogen ion in the tubules part of and that form the ammonium, that is NH4 plus. What this ammonia do, ammonia helps to remove the hydrogen ion and it's converted into the bicarbonate, and that is stable part. This is allowed to get more acidity and also help to removal of the bicarbonate from the our body. So this is the mechanism how ammonia help to maintenance of acid base balance in our body. Next importance is a RAS system. This is very important for the uh, this is very important for the understanding of kidney function. RAS system stand for the renin angiotensin aldosterone system. This is the full form of RAS, that is renin angiotensin aldosterone system. This is responsible for maintenance of blood pressure in our body. uh, in the RAS system, also there consists of one enzyme that is known as a renin. This enzyme is secreted by the JG cells, that is the juxtaglomerular cells of the kidney, into the bloodstream. What this renin do? Renin help to the synthesis of the various hormones like pre-pro hormones, or that is a pre-pro insulin. The pre-pro insulin has a little biological effect, or this have the very micron biological effect in our body. And there is a one renin also help to conversion of the angiotensin to the angiotensin 1. Here you can see in the figure the angiotensin in the presence of renin that converted into the angiotensin 1, and after that there is a one enzyme that is known as a angiotensin converting enzyme, which is commonly known as ACE enzyme, that help to conversion of angiotensin 1 to angiotensin 2, and that angiotensin 2 have the various biological function. When there is a decreasing the arterial blood pressure in our body, or there is a alteration the blood pressure in our body, then this renin and RAS system will activate. Angiotensin that converted into the angiotensin 1 in the presence of renin, and this angiotensin 1 is converted into the angiotensin 2 in the presence of ACE enzyme. This angiotensin 2 show the various biological action in our body that help maintenance or retention of the sodium and water. It also reduce the um, reflex to increase the pressure in the central nervous system. It also help to vasoconstriction, and it also activate the hypothalamus to consuming the more water. So these are the functions of RAST, RAS, renin, and angiotensin AC enzyme. So urinary system disorders normally various more than 100 disease and disorder that are associated in the urinary system. But I will discuss here like chronic kidney disease, acute kidney disease, acute kidney injury that is uh, due to the some infection, dehydrations, or maybe more intake of drugs like paracetamol or other non-steroid anti-inflammatory drugs that are responsible to cause the nephrotoxic, that is acute kidney injury, and that sudden decreasing in the kidney functions. It's in case of AKD, the GFR rate is around 90 to 95. So if the acute kidney injury is untreatable, that lead to the chronic kidney disease like gradual loss of the kidney functions, and this is known as a uh, stage 5 of the GFR also. And that chronic kidney disease that may be caused by the acute kidney injury, or maybe diabetes, or if persons have the high blood pressure, or maybe some genetic factors. Next, disorders of the kidney is a kidney stones. That means there is a depositions of hard materials or minerals that lead to the pain or blockage of the urethra in the kidney. Next is a PKD, that is a polycystic kidney disease. It is a genetic disorder that is characterized by formation or growth of the cyst in the kidney. Some other disease that are associated in the urinary system like urinary tract infection, and this is most common observed in the female as compared to the male, and that can affect the bladder and urethra of the urinary system. Next, you can see in the diagram also, this is the one diagram of the urinary tract infection. Diabetes, nephropathy. In individual with diabetes, they have the decrease the GFR, that is a glomerular filtration rate, and that also characterized by the diabetic nephropathy, and that may be due to the infections or maybe other conditions. So diagnosis method for urine system, various method which are used for the diagnosis of urine system like urine analysis. In the urine analysis, we see the color, that is physical examination, chemical and morphological examination of the urine. Second is a test for assessment of glomerular filtration. That is, here we can measure the GFR of kidney with the help of some chemicals like inulin. We can use for the measurement of GFR. Third method, that is test for measurement of renal plasma flow. Here also we can use this some dye to examinations the renal plasma flow. And last, with the help of tubular functions, we can also diagnose the urine related disorder. So recent research in the urinary system, first gene therapy. This is the most common method, and scientists are doing a good job in the gene therapy to treat the chronic kidney disease and acute kidney disease. Next is the artificial kidney development. In the preclinical, in the animal like mouse and rat, like they have designed the one wearable dialysis device that is known as a artificial kidney development. You can see in this diagram. This is also going to be used clinically. Next, UTI treatment, new antibiotics like cephalosporin or ciprofloxacin category, and some immunity system therapies are also developed by the scientists, and they are uh, under the clinical trials for the treatment of antibiotic resistance in the urinary tract infection. Next, stem cell therapy. As per the preclinical studies, the stem cell therapies of the show the very potential effect for the treatment of kidney disease like CKD and AKD. Some biomarkers. Research has found some novel biomarkers for the early detection and better understanding of the kidney related disorder. So at the last, I'll show one video. I think, sir, is it visible? Video?
Sir, video not visible.
Sound?
These are two bean-shaped organs located in the abdominal cavity. They are located in the retroperitoneum underneath the intraperitoneal organs, which have been removed in this illustration right here. Each kidney is invested in a thin connective tissue capsule known as you would expect, the renal fibrous capsule, which we see here. This protects the kidneys from damage or injury. Also seen from this view, at the superior pole of each kidney is an endocrine gland enclosed in a fibrous capsule and a cushion of perirenal fat called the suprarenal or adrenal gland, which we highlighted here. Now, these glands are not part of the urinary system and function instead as part of the endocrine system. Don't forget that. At the medial border of each kidney is the renal hilum, where the renal arteries, renal veins, and the renal pelvis enter and leave the kidneys. Note that the right kidney sits slightly lower than the left kidney, since it sits posterior inferior to the liver. And by posterior inferior, I mean basically underneath. Now that we looked at the anatomy of the kidneys, let's explore the function. The main function of the kidney is to eliminate excess bodily fluid, salts, and the byproducts of protein metabolism. This results in the production of urine that is transported out of the kidneys through the ureters, which happen to be the next structures that we're going to be talking about, the ureters. The ureters emerge from the kidneys posterior to the renal vessels. They are actually a continuation of the renal pelvis of the kidneys, which we just looked at in the renal hilum image. This video is not over yet. Continue watching now the full video at kenhub.com.
Hello.
Hello.
Sir, I am extremely sorry due to the some network issues. Some part are missing to share. So definitely I'll share the slide to the audience.
Okay, sir. Thank you very much, Dr. Khadagras, sir, for your enriching and details of sessions on Module 3, Respiratory and Urinary System. Your insights were extremely clear and helpful. So I further request to all participants, please feel free to ask any doubts or queries you may be of related of these sessions. Any doubt, any queries? on your side, please ask to the resource person. So I thank you to Dr. Arna sir and all participants. So we will meet.
Sir, I will share the slide and you can share to the. Hello.
Okay, sir. So we will meet on afternoon
Hello.
sessions with the demonstrations of tidal volumes and vital capacity experimentations and demonstration of reflex activity experimentation with the resource person of Miss Ritu Kant madam. So thank you very much. And one of the important of message to all of you, the same link, morning link already have work to the afternoon. So you will be join of same link. Thank you very much.
Thank you, sir. Thank you so much.
Okay, sir. Thank you very much, sir.